Surface anatomy, it is the projection of different structures like the underlying structure of the body, like arteries, nerves, viscera, okay, and others over the surface, body surface. So again I am repeating, what is surface anatomy? It is the surface projection of different underlying anatomical structures like nerve, artery, vein, different viscera, their borders, surface borders and outlines on the body surface. So that is a branch of, because anatomy has got different branches like surface anatomy, radiological anatomy, what we do in our dissection, that is also a part, that is the gross anatomy. And the gross anatomy again is divided into several regions, regional anatomy. It can be described as systematic way, nervous system, blood vascular system, angiology, then osteology. So there are different branches, embryology, there are different branches, radiological anatomy. So surface anatomy is also a branch of the anatomy. Now in superior extremity we have to put some points on the body surface and we have to draw some lines. Suppose the pisiform bone, we have to put a point there. We have to know where is the pisiform bone, how we can locate the pisiform bone, then we can put a point. There are some sticks, swab sticks, by which we can put a point. I will show you. And there are some cards and powders. This is a swab stick. Okay. So we can put like this. Put a point, single point, with the help of this stick. Actually, basically, it is a broomstick, and the edge we have put one cotton. Okay, so that becomes a swab stick, and by this, with the help of this swab stick, we can put a point. Anywhere we can put any point. চন্দনের ফোঁটা দেখেছো? ফোঁটা দেওয়া. This like that. And there is one card. If I place the card, actually the card is at the edge, I am putting some powder, okay, and if I press it over the body surface, I can draw a line. Actually, the nerves are represented by single line, whereas artery or vein is represented by two parallel lines. Artery, veins. Okay. Again, any body surface like liver. Liver has different borders. Heart has got different borders. So those borders can be represented by single line. So in superior extremity, নার্ভাস লাগছে ডাক্তারিতে নার্ভাস জিনিস নেই so there are some points that all the points or the lines which are written in your textbook are not in within our syllabus. So I will ask you to open your exercise book, okay, and I will tell you what are those points and lines which are included in your syllabus. When you will think that you are ready, just tell me. If you are ready, then you just tell me that yes sir, we are ready. Then I will tell you. First I will tell you the points. Ready? The point number 1, angle of acromion process. Is it familiar? Angle of acromion process. Acromion process you have seen in scapula, clavicle, humerus. Thank you. It is seen in scapula. So there are some process: spinous process, acromion process, coracoid process. Okay. So first one is angle of acromion process. Your friend will help you. The next one is number 2, pisiform bone. Number 3, head of the radius. Number 4, head of the ulna. Number 5, tip of coracoid process. Tip, T-I-P, tip of coracoid process. Number 6, styloid process of radius. Number 6, I think, no? Then number 7, radius. Radius এর একটা styloid process থাকে. So styloid process of radius, now styloid process of ulnar. Next, hook of the hamate. Hook of the hamate. Hook. Hook of the hamate. There is one bone in the carpal bone which is called hamate, which looks like hammer, which has got one hook. So hamate. Next, number 9, I think. Beginning of brachial artery or median nerve or ulnar nerve or ba. In Bengali it is called ba. Beginning of radial artery or median nerve or ulnar nerve or radial nerve. Median nerve, medial nerve, median nerve, median, ulnar and radial nerve. Number 10, beginning of brachial artery, beginning of radial artery or bifurcation of brachial artery. Bifurcation of brachial artery. Brachial artery is divided into, very good, there is one bifurcation point. So that is called, so the bifurcation of the brachial artery. Now about the lines. Write down the lines. Left axillary artery. Left axillary artery. Number 2, brachial artery. Number 3, radial artery in the forearm. Radial artery in forearm. Ulnar artery in forearm. Next. Next is superficial palmar arch. Superficial palmar arch. Next, radial nerve in back of the arm. I think that is 6, number 6. And the last one is ulnar nerve in forearm. ulnar nerve in forearm. Okay. Now I will show you how to put the points, how to draw the lines. Okay. And you will practice in the cadaver then. And when you will reach the hostel or reach the home, you can practice it on your, mutually you can practice it on your friends. Okay, that is better. Now, tell me the first point. The first point, number 1 point. Angle of the acromion process. I will show you how to do it and you will practice it. You have to feel the scapula from the back and we can feel the spinous process, and suddenly there will be change in direction of the spinous process to the acromion process. So that point, we have to put a point here. That is the angle of the acromion. So we have to first feel the spinous process. Then we will go laterally. I can feel the spinous process here. I am going laterally. And suddenly I will see that there is a change in direction. So that is the angle of acromion process. Here I will put a point like this. I will put a point. Next, pisiform bone. We can flex the forearm and I can feel the tendon of the flexor carpi ulnaris here, and it ends at the round shaped bone that is nothing but the pisiform. Which one? Which side? Why are you showing this one? This is the flexor surface. This is the extensor surface. We are concerned with the flexor surface because here I will get the flexor carpi ulnaris muscle. So I will flex the flexion of the wrist, and here I will get the tendon. That is the flexor carpi ulnaris. You can feel in your body also. So this is flexor carpi ulnaris, and which ends in a point, in a bone. That is rounded bone, that is nothing but the pisiform bone. Here I can safely put a point. Because I cannot put a point here because I cannot do it. So pisiform bone. So what is the importance of this bone? This is a sesamoid bone. What are the characters of the sesamoid bone? It is within the muscle tendon. It develops within a muscle tendon. Okay. It gets its nutrition from that muscle. So it has got no periosteum, no Haversian system. Parasite. Which one is the largest? Yes. So these questions will gradually, they will come. and examiner will ask. Okay. Next, feel your pisiform bone. You have to feel the flexor carpi ulnaris. First flex it. In the flexor compartment, there are superficial flexors. Flexor carpi radialis, palmaris longus, then is the flexor carpi ulnaris. Already it has been taught. So, we can feel this bone. Next, head of the radius. On the extensor surface, we are getting, when we are looking at the back of the elbow, we are getting the olecranon process. If we go lateral to it, we can find a depression. Within that depression, we can feel the head of the radius. And interestingly, we can find one thing, when we pronate and supinate, there is movement of the head of the radius. During pronation and supination, you can feel that head of the radius rotates. And we can put a point here. So that becomes the head of the radius. So how we can approach in the extended elbow, we have to first search for the olecranon process. We have to go laterally, there is a depression. Here we can find the head of the, we can feel the head of the radius, which moves during pronation and supination. Feel karo? Korecho? Clear? Next is head of the ulnar. At the extensor aspect of the elbow, we can find a prominent bulging. I am very sorry, extended wrist, just back of the wrist. Here we can find one bony prominence. Okay, so that is the head of the radius. I am very sorry. Head of the ulna. Head of the radius I have already shown you. So this is the head of the ulna. And if we go posteromedial to that one, if this is the head of the ulna, Eita Baba, Jeta Dekho, most prominent at the back of the wrist. Okay, it becomes very prominent during flexion. It becomes very much prominent. So here we can put a point. Okay. Then styloid, I think styloid process of radius. Oh, tip of. Before that, I should go to the tip of the coracoid process. First, we have to feel the clavicles. This is the sternal end, and if we go laterally, this is the acromial end. And we have to divide it into medial 3/4 and lateral 1/4. We have to put a point at the medial 3/4 and lateral 1/4. We have to search this point first. Okay? And we have to go 1 inch below that point. First, we have to search the point which is located at the medial 3/4 and lateral 1/4 of the clavicle. Look, if we go 1 centimeter below this point and if we press, the person will feel a pain because this is the tip of the coracoid process. Okay, and if I press, and it is covered by the anterior fibers of the deltoid muscle. It is under the coverage of the deltoid muscle. Why it is so much important? Because this tip of the coracoid process gives origin. Hey chale, tell me, the tip of the, rethink, the tip of the coracoid process. Because your friends are uttering, first you were wrong. First you were wrong, now you are getting the clue. So during the class, you should remain attentive, otherwise you will miss many things. Keep your ear towards us. So tip of the coracoid process. Next is, there is coracobrachialis and the short head of the biceps we have already mentioned, and he has also managed that one. Now is the styloid process of radius, I think. How we can find? We have to search for the anatomical snub box. And if we go proximally, we can find within the anatomical snub box. If we go proximally, we can find styloid process. Then is the scaphoid. Then is the trapezium. So here we have to fill on the lateral side of the forearm, on an extensor aspect, we have to search the anatomical snub box. And we know the proximal part of it, the floor of the anatomical snub box is formed by the head of the radius. So here we can find, styloid process of the radius. Okay, so we can find the styloid process of the radius. Next is styloid process of ulna, I think. Okay, how we can feel? We have seen this is the head of the ulna. So this is the ulna, this is the posterior border of the ulna, and posteromedially, if you can feel, there is a point posteromedial to the posterior border. If we trace the posterior border, and if we go down posteromedial to the head, we can find the end of the ulna. That is nothing but the styloid process of the ulna. What is the peculiarity between the styloid process of radius and the styloid process of ulna? Styloid process of radius is 1.25 centimeter below the level of styloid process of ulna. So we know there are different movements Towards the midline is adduction and away from the midline is abduction. So angle of adduction is more and angle of abduction is less. Because of the fact the styloid process of the radius is 1.25 centimeter below the level of the styloid process of the ulna. Next, hook of the hamate. We can feel this is some eminences in the palm. One eminence is called thenar eminence. One is called hypothenar eminence. If we go 1 centimeter below, 1 inch below the pisiform bone and just over the hypothenar eminence, if we press, we can feel the hook of the hamate where we can have a pain. You can feel a pain. If you press it at the middle of the hypothenar eminence, she can feel it. Because this hook of the hamate is present within the hypothenar eminence 1 inch below or 2.5 centimeter below the level of pisiform bone. And it is at the level of medial border of the ring finger. This is the ring finger. This is index. This is thumb. This is index. This is middle. This is ring. This is little. So, hook of the hamate is just at the medial border of the ring finger. Here I can feel. And if I press, you can have the pain. বলো লজ্জার কিছু নেই একটু একটু আরে একটু you will get the pain. So that is the hook of the hamate. Hook of the hamate from here actually there is pisohamate ligament from pisiform bone to the hamate. We can get one ligament, and that ligament is nothing but the degenerated part of the flexure carpi ulnaris muscle. And laterally we can find some important structures. Okay. And also we get the origin of the hypothenar muscles, short hypothenar muscles. There are thenar muscles, small thenar muscles, abductor, flexor, and opponents, pollicis. 3 muscles are there here. Similarly, there is abductor digiti minimi, flexor digiti minimi, and opponents digiti minimi. So we get the origin of these muscles. In detail, I'm just omitting the details. Okay. Next. Beginning of brachial artery or ulnar nerve, median nerve, radial nerve. Okay. We know the axilla. We know this is anterior axillary fold. This is the posterior axillary fold. And we have to search for the lower limit of the axillary folds. This is the lower limit and this is the another lower limit. Okay. This is the lower limit of the anterior axillary fold. You can feel in your body. The axillary fold. Anterior axillary fold. The lower limit of the anterior axillary fold is here. And where is the? This is the posterior limit of the. This is the lower limit of the posterior axillary fold. and we can join a line here. We have to search the lower limit of the anterior and posterior axillary folds. Definitely there are some points. So I will get 2 points and I will join a line. On that line, if I put a point at the junction of anterior 2/3 and posterior 1/3, anterior 2/3 and posterior 1/3, at the junction of anterior 2/3 and posterior of that line which is joining the lower limit of anterior and posterior axillary folds. So that becomes a point, and that point is nothing but the beginning of brachial artery. So this becomes the beginning of the brachial artery, or this becomes the beginning of ulnar nerve, beginning of radial nerve, beginning of the median nerve. Okay. So we have to search the lower limit of anterior axillary fold and lower limit of the posterior axillary fold, and we have to join. So we will get a line. So on that line, we have to put a point at the junction of anterior 2/3 and posterior 1/3. So we can get that point. Next, brachial artery. We know this area is called the cubital fossa. In the cubital fossa, if we flex it, we can get the tendon. That is biceps tendon. Medial to it, we will get the arterial pulsation. That is nothing but the brachial artery. If we flex the elbow, we can feel the tendon of the biceps brachii, not the biceps femoris. This is biceps brachii. So medial to it, we get the artery. Tendon, artery, and more medially there is nerve. That is median nerve. Okay. So we have to go. We have to go 1 centimeter below this level. If we go 1 centimeter below the level of the elbow, okay, over this artery, we will get the end of this brachial artery or beginning of the radial or ulnar artery. Or this point is the bifurcation of radial, this is the bifurcation point of the brachial artery, which into radial and ulnar artery. Okay, so this is the point. So what is the elbow? The level of the elbow, we can get it by joining the medial and lateral epicondyles. So we have to make a line. We have to go 1 centimeter below it, and over the brachial artery, we can put a point. This is the lower limit. Next, left axillary artery. We know this point is the end of the axillary artery or the beginning of the brachial. So one point is already made by you. And another point is very easy. We can feel the clavicle. We have to find out the middle of the clavicle. And we have to put a point just middle of the clavicle. Okay, here just below the middle of the clavicle, midpoint of the clavicle. Midpoint of the clavicle is the key. Just below the midpoint of the clavicle, we have to put a point. And another point is already ready. That is the line joining the lower limits of anterior and posterior axillary fold, and we have to put a point at the anterior 2/3 and posterior 1/3. And we have to join it with two parallel lines. Two parallel lines like this. Two parallel lines. One line like this, one line like this. We can put it, you can practice it over the cadaver. Over the cadaver, you can practice it. You have to feel the clavicle. You have to put a point one below the midpoint of the clavicle and another point at the axilla, just lower limit of the axilla, and join it with two parallel lines. Clear? Axillary artery, when the arm remains abducted, it is convex upwards. When the arm remains, when it was adducted, when it remains adducted, it remains convex. When it is abducted for 90 degrees, okay, it becomes straight. And when it is abducted for 120 degrees or 180 degrees, then it becomes concave upwards. Okay, it becomes concave upwards. Concave upwards. Convex upwards, straight, and concave upwards. Okay. Next. So, examiner may ask axillary artery, what are the different parts? Part 1, part 2, part 3. What are the branches from part 1? What are the branches from part 2? What are the branches from the part 3? Okay. Which muscle divides this axillary artery into 3 parts? Teres minor? Pectoralis, right. Pectoralis minor. Okay. And from the part 1, 1 artery. From the part 2, 2 arteries. From the part 3, 3 arteries. বলতে পারবে? বলো। So, very good. Don't invite any question to the examiner. এইবার দেখো, আমি তোমাকে বিপদে ফেলে দিতে পারি এক্ষুনি। Sir, there are 4 branches from the thoracoacromion artery. Can you justify the name of the thoracoacromion artery? Achha, what are those branches? Sir, deltoid branch, clavicular branch, pectoral branch, acromion branch. Which branch you will find in the deltopectoral group? Deltoid. If you know, if you are confident, then you can channelize your examiner to that area. An examiner is very clever. He knows that I am being channelized to that area because he is sound on that area. Immediately the clever examiner will stop. No, I am not interested about the thoracoacromion artery. Okay. And again they will, what is the accompanied vein of the thoracoacromion artery? So, here, do you know this thoracoacromion artery pierces some fascia? Do you think that same vein will pierce this clavipectoral fascia? Whether this thoracoacromion vein will pierce the, now whether that thoracoacromion vein will pierce the clavipectoral fascia or not? Answer is wrong. Yes is wrong, no is wrong. So that will be when sometimes it pierces. So if you say no, that is wrong. And if you say yes, that is wrong. So there are some tricks. So if examiner wants to actually put you in a trouble, okay, so he or she can. So don't go beyond your ask question. But this is the tip, never invite. Next, brachial artery. First, this is the beginning and this is the end, and we have to join with two parallel lines. Brachial artery. Hoye gelo. The beginning, you know, here is the beginning. Already we have discussed, and this is the end. So we have to put two parallel lines. You can practice it, you will practice it in the body. Okay. Next, radial artery in the forearm. The first point is already made by you. At the next point, where we can feel the radial pulse. How we can get it? We have to flex it. Here we will get the flexor carpi radialis. The tendon of the flexor carpi radialis near the lower part of the radius. Here we will get the tendon, flexor carpi radialis, and most laterally you can get the anterior border of the radius. In between you can feel the pulsation of the radial artery. So you have to join these 2 points with 2 parallel lines. আরে বাবা পালস যেখানে ফিল করো সেটাই তো, সেটা কি? এটা হচ্ছে flexor carpi radialis, এটা palmaris longus, এটা flexor carpi ulnaris। এরকম করো, এই দেখো flexor carpi radialis, ঠিক আছে? এই দেখো, এবার দেখো anterior border, এখানে ফিল করো, দেখবে রেডিয়াল পালস পাচ্ছো। Actually pulse করে, in physiology you will know how to feel this pulse. Your Akash sir will tell you how to feel the pulse. Rate, rhythm, volume. Rate, rhythm, volume. There are 3 points. So this is the radial pulse. Very important pulse. So here we can put a point. Okay? Already that point is already available. First point. We have to join these 2. Okay? Radial artery, then ulnar artery. Same. The ulnar artery, very easy. The first point is already done. The bifurcation point of brachial, that is the ulnar. And you have to search the pisiform bone. Pisiform bone, flexor carpalis, pisiform bone. Rounded appearance. And go lateral to that pisiform bone. Here we know the ulnar artery is there. So we have to join these two. We have to feel the pisiform bone. Just go lateral to the pisiform bone and put a point, because lateral to the pisiform bone we will get the ulnar artery and ulnar nerve. Right? Lateral to the pisiform bone we will get the ulnar artery and the ulnar nerve also. So ulnar artery, again we can do it with convexity towards the medial side. Hello. Next, superficial palmar arch. Have you seen? In the dissection of the palm, actually, in the palm, which side is relatively hot? Palmar side or the dorsum? Which one is relatively hot? Yes, because there are two arches. One is superficial palmar arch and one is deep palmar arch. In the palmar aspect, okay, which one is relatively hot? The palmar aspect or the dorsum? Palm. Because of the fact there are two arterial arch. One is superficially placed and one is deeply placed. We know the tendons. That one arch is in front of the tendon and one arch is behind the tendon. So superficial arch is over the tendons or flexor tendons of the arm. Now how we will put the points? Already we know this is the hypothenar eminence. We have to put a point here at the middle of the hypothenar eminence. Or you can put a point just lateral to the pisiform bone, then at the middle of the hypothenar eminence. Then you have to put another point at the middle of the thenar eminence. And you have to join these three points with a curved line. The concavity is upwards or convexity downwards. Right? দুটো লাইন দিতে হবে এরকম এরকম so you can find হাতটা দেখাও না ওদেরকে হাতটা দেখাও this convexity is downwards. Actually anatomically it will remain like this. So this convexity downwards or concavity upwards, this is up, this is down. So this becomes the superficial palmar arch. Superficial palmar arch is contributed mainly by the ulnar artery, whereas deep palmar arch is contributed by the radial artery. Now this point, this height of the height of the convexity will go up to the distal border of the thumb, extended thumb. So this will go up to the level of the distal border of the extended thumb. Okay. So from here we will get some branches which will ultimately in different way, okay, it will anastomose with there are metacarpal arteries, palmar metacarpal arteries, dorsal metacarpal arteries, and ultimately they will form the digital arteries. Okay, now yes, this is due to the actually this contribution is from the radial arteries. Radial artery may go below these thinner muscles, or it can go superficially over the superficial muscles, the superficial branch. Radial artery will divide into superficial and deep branch. Deep branch will form the deep palmar arch, and superficial branch may traverse superficial to these muscles and will join. And in that case, you can feel, if you can feel in your body, then that artery is traversing superficial. So next radial nerve is in the back of the arm. Already we got this point. This is the very important point. Now radial nerve in the back of the arm. First is the beginning. Okay, this is the beginning. So this is the beginning. From the back, this is the beginning. That is the anterior 2/3 and posterior 1/3 of that line. Okay, this is the beginning of the radial nerve, ulnar nerve and median nerve. So one point is already made, and you have to put another point here. How you can put that point? We have to fill the insertion of the deltoid, and we have to fill the lateral epicondyle. Roga manush tumi acho esho. So first point is here, and another point we have to fill the insertion of the deltoid, and we have to fill the lateral epicondyle, and we have to join these two points. Deltoid muscle, delta shaped. D means delta. Delta মানে আমাদের সুন্দরবনের ডেল্টা দেখেছো? এখান থেকে this is a deltoid muscle. Here I have shown you the deltoid muscle in the cadaver. This is the insertion of the deltoid. Okay? Insertion point of the deltoid becomes tendon. You can feel the tendon also. দেখো এখানে হাত দাও, টেন্ডন ফিল করবে এখানে। এইখানে দেখো না, আচ্ছা এই ছেলেটির বডিতে হাত দিয়ে দেখো, এসো লজ্জার কিছু নেই, এখানে দেখো, ঠিক আছে? একজন তো তুমি ফেল করো না, তুমি সরো একজন দেখো, এটা দেখো দেখেছো টেন্ডন মতো হয়ে গেছে। এবার তুমি ওকে বুঝাও, এবার তুমি সরো না, এবার তুমি ওকে বুঝাও ওর বডিতে যাও। So this is the insertion point of the deltoid. Okay, and we have to find the lateral epicondyle. Hey, lateral epicondyle of the humerus. Okay, so we have to join these 2 points. So we will get a line. এবারে এই লাইনটা পেলাম তো অনেক কষ্ট করে। So we have to Then again we have to put a point over this line. Where? At the junction of upper 1/3 and lower 2/3. At the junction of upper 1/3 and lower 2/3. Here we can put a point, and you have to join these two points. This is the insertion point of the deltoid. We have to fill it. We have to fill the lateral epicondyle. We have to join these two lines, and we have to put a point at the upper 1/3 and lower. In some books, it is written upper 1/4 and lower 3/4, or whatever might be. So here we have to put a point. Okay, and we have to join these two points. One point is already ready-made point. বুঝেছো? এই একটা রেডিমেড পয়েন্ট আছে, সেটা যে বিগিনিং অফ brachial artery, beginning of median nerve, beginning of ulnar nerve, beginning of radial nerve, and another point is here. এবার উল্টানো বডিতে রেডিয়াল নার্ভটাকে প্র্যাকটিস করবে। না করলে কোনোদিন মনে থাকবে না। একটা বডিতে উল্টানো ছিল, আচ্ছা দেখছি। The last thing I think ulnar nerve in forearm. Ulnar nerve we can feel behind the medial epicondyle. We can feel. So this point is ready. This point is ready behind the medial epicondyle. Huh? And another point is lateral to the pisiform bone. Duto point is already ready. These 2 points are already ready. Then another point, again this lateral epicondyle and pisiform bone we have to join. Again upper 1/3 and lower 2/3 we have to put a point here. So number 1, number 2, number 3. The first point is behind the medial epicondyle, where you can feel the এই মেয়ে, তুমি এদিকটা দেখতে পাচ্ছ না কেন? তোমরা দুজন ওখানে এদিকে এসো, এদিকটা দাঁড়াও। আরে ওই মেয়েরা কোথায় কোথায় ওরা জল খাচ্ছে, ওখানে আরেকজন গল্প। এই তোমরা ওইখানে গেলে হবে, এখানে এসে দেখো। এই মেয়ে, আর ওখানে তো বেশ সেই মধুসূদনের সেই কবিতা ছিল, দাঁড়াও পথিক বর জন্ম যদি এ বঙ্গে, সেইভাবে তোমরা ওখানে সব বসে আছো। হ্যাঁ, তিষ্ঠ ক্ষণকাল। হ্যাঁ, তো তোমাদের এই জায়গাটা ফিল করো, behind the medial epicondyle. Number 1 point. Number 2 point, lateral to the pisiform bone. And the third point, you have to join the medial epicondyle and the pisiform bone. In some books, upper 1/4. In some books, upper 1/3. What it hardly matters. Okay. So you have to put another third point. So you have to join these 3 points, and you will get the ulnar nerve. Ulnar nerve is represented by single line. Ulnar nerve passes behind the medial epicondyle, and there is medial ligament of the elbow, and there is lateral ligament of the elbow. So this ulnar nerve passes in between the fibers of the ligaments, and it passes behind the deep border of the deep origin of the pronator teres. Okay, and it moves in hand, and it supplies which muscle in the forearm? The medial part of the flexor digitorum profundus. Very good. The lateral one is supplied by, not exactly from the median nerve, but from the branch. There is the anterior interosseous branch of the median nerve. Okay. So this is a hybrid muscle, and from this muscle you will get, from the tendons you will get some lumbrical muscle, like worm-like muscles. First, second, third and fourth lumbricals. The first and second are supplied by the median nerve, and third and fourth, because it is taking origin from the flexor digitorum profundus. So medial part is supplied by the median nerve. So first and second is supplied by median nerve, and generally the third and fourth supplied by the ulnar nerve. Sometimes the second might be supplied by the ulnar nerve, or the third might be supplied by the median nerve. Okay, so there are some palsies: median nerve palsy, ulnar nerve palsy, radial nerve palsy. If there is a pressure over this radial nerve, which is, no, it is, when it is within the spiral group, what will happen? Saturday night syndrome. After drinking a lot, the person gets its consciousness and puts back of the arm over the armchair, and on the next day there is wrist drop. Wrist drop. Because of the fact this part, the radial nerve is affected. And crutch palsy is when that in the nerve is affected in the axilla. When radial nerve is affected, exactly, in the axilla. That is a crutch palsy.